Welcome to the Lou Catino Show, where we can learn to reimagine our lifestyle.
Today, we talk about lipomas, which are also known as skin lumps, which are accumulations of fats, different parts of the body. We have a lot of patients over the years who come to us with lipomas. Sometimes children come to us with this, but it's mainly adults. And all of a sudden, they develop these lipomas and they get worried. They think it's a tumor, they think it's cancerous. Well, lipomas are actually non cancerous fatty tissue growths that slowly develop under your skin. They're rarely harmful and usually they don't require any treatment at all, although there are some treatments that you can do if you find that you don't want to have those lipomas on your body. So people can, of any age, can basically develop a lipoma, usually between the age of 40 to 60. But today we're seeing it develop in people and young boys and young girls as well, who don't have the best of lifestyles, where there's a lot of sleep deprivation, there's already obesity, very poor eating habits, some patients with cholesterol as well, very high uncontrollable cholesterol levels. So lipomas are basically classified as benign growths or benign tumors or fatty tissues. It's not cancerous. Usually, if you have lipomas, your doctors will get it checked out. They can take a sample and have it checked just to make sure that it is not cancerous. It's always good that you don't assume you have a lipoma because very rarely could you have a liposarcoma, which looks very similar to a lipoma. So it's best that you get it checked up just to make sure that everything is okay and it is not cancerous. So lipoma generally will be very easy to move if you prod it with your finger. It can move around, softly like jelly. It feels soft when you touch it, and it's just under the base of your skin. It's usually colorless, unless, of course, you have pigmentation on that part of your skin where the lipoma is, then it would be of different color, and it grows very, very slowly over time. Most lipomas would be found on the thighs, inner thighs, outer thighs, at the base of the buttocks. Then be found on the arms, shoulders, and at the side of your neck, and even at the back of your neck. So usually, sometimes steroids can be used directly on the infected area to shrink the lipoma, but it will not remove it completely. So a lot of people take medical treatment for steroid injections just to reduce the size of it. But like I said, it doesn't remove it completely. Healthcare professionals may also mostly diagnose this with a physical exam, with touch. Sometimes a biopsy may be taken just to make sure that it isn't cancerous. Further testing, sometimes if there are correlations, could be with an MRI or a CT scan. A lot of people don't like having these lipomas, and the most common way to treat a lipoma then is to remove it by surgery. So usually this is one. Liposuction is another treatment since all lipomas are fat-based. This procedure can also help to reduce the size. To prevent it from coming back completely, doctors can surgically remove it completely. Although it's not guaranteed, it may just grow back again, but usually that is how it is done. Now, in addition, what we're seeing in integrative and lifestyle medicine, that while there are not too many explanations, sometimes it is it is linked to very, very rare syndromes that you may have, like a Gardner's syndrome, or you can have a Cowden syndrome. So over and above that, we are seeing correlations with obesity. So when there's chronic obesity, there is a possibility to develop lipomas as you age with obesity, liver disease as well. So it's very important to correlate your lipomas with any abnormal activity in your liver. So we usually do a liver function test to check the SGOT, SGPT. Those are your liver enzymes, any damage to the liver. We're frequently seeing a correlation with alcohol abuse. So people who abuse alcohol, binge drinking very, very frequently, not looking after their overall health. So there's too much of burden on the liver. We see the development of lipomas. And you should understand that your liver has a connection with fat in the human body. So it's very important to look at your liver, and of course, glucose intolerance as well. We're seeing this in a lot of pre-diabetics and diabetics who suffer from glucose intolerance. So there's a lot that can be done with your lifestyle. Lifestyle can be used to treat obesity in so many different ways. Metabolic syndromes, where there is excessive body fat, high blood pressures, diabetes together. Looking at insulin resistance, today we can use lifestyle to make insulin resistance much, much better so that your body learns how to handle blood sugar levels and learns how to handle insulin more effectively. You can look at cleansing of the entire liver or optimizing the efficiency of the liver to work better. through lifestyle, through foods, through better sleep, through exercise, and of course, helping the body reduce the burden of the amount of stress that the liver goes through. So we know that everything goes through the liver, whether it's medicines, whether it's pollutants in the air that we breathe, the refined fats in our food. So the liver's constantly working to keep us alive. It's constantly working, and sometimes we can, by making dietary changes, by cleaning up our diet, by working out regularly, so we keep blood circulation strong, because it's only great blood circulation that also helps us to remove toxins from the human body. All of this can make a big use. Of course, alcohol use disorder is a big problem, and through counseling or through changing of lifestyles, this can be made better. And especially if someone's drinking alcohol, all the more reason to look after the liver. So while there are many things that you can do from an aspect of diet, which has a protocol of treating the liver and obesity, turmeric stands out in a lot of natural treatments in Ayurveda for lipomas. Applying a mix of turmeric powder, honey, and ghee, pure ghee, on the lipoma is known to help reduce the size but not permanently take it away. And an herb called sage is also used as a natural treatment for lipoma, where a sage extract or a sage essential oil is mixed with a carrier oil. About 3 to 4 drops is mixed with a carrier oil, and it is also applied externally. But none of these are documented to work 100% efficiently. Well, nothing in nature is guaranteed, but it is something that you can try if you're looking at reducing the overall size. So it all comes down to, again, when a lipoma to me is a symptom, why is it happening? What has triggered off a lipoma in your body? And then you assess, is it obesity? Is it my liver? Is it my glucose intolerance? Is it my cholesterol levels? Is it my lifestyle, my alcohol abuse? And then you start to put in your lifestyle changes revolving around your nutrition, your activity, your sleep. Because you see, while we sleep, a lot of healing happens. The body is able to realize what's wrong. And the body's constantly looking out to see what's wrong in your body and trying to fix it. And unless we compromise things, like we compromise our sleep, we compromise the healing process. And of course, stress has a connection with everything, because stress keeps us out of homeostasis. When we're in homeostasis, everything is working just fine. When we're out of homeostasis, we're in disharmony. So a lot of unexplainable things that happen in the human body happens when we're out of homeostasis. So to come back to homeostasis, again, it is your overall lifestyle. So this is all about lipomas and things that you can do and things that you can be aware of. I hope this helps you and your family. Till next time, eat smart, move more, sleep right, breathe deep, and remember, you care is all about you.
Stay tuned for more. We're going to continue our journey, learning, sharing, and evolving.